Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we are going to talk about why you are having headaches and migraines and why something like massage is not necessarily the answer. Okay, so this is something where in what we do here at Novera Headache Center, we are using hands-on techniques for in-person care to help restore function, mobility, specifically to the upper part of the neck, to the shoulders, to the jaw. Now, it looks very similar to what you might see done at a massage therapist, potentially even at a chiropractor. And so what we're going to talk about is the what behind what we do, which is going to likely explain the underlying problem that many people are dealing with when they have headaches or migraines. And then the difference between what we do and, let's say, a massage therapist. All right. So the goal of this podcast is for you to have a better understanding of what is happening to cause these symptoms and then what to do about it, and specifically why seeing us at Novera, or someone that's able to apply the same types of techniques is going to be your most valuable resource in getting out of this problem. All right, so let's just jump right in. A lot of these podcast topics come about because the questions that people ask or the perceptions that people have, it's required that we do a level of education in order to make it clear. Because if we can be clear and people understand their situation better, they can move forward in a way that's more helpful for themselves. And this is one of those confusing things that sometimes people need clarity on. If you have been to a massage therapist and have seen benefit from it, they're working through the muscle tension. The muscle tissues have tension, they have sore spots, they have trigger points that build up over time. We all carry tension. Some carry it more in their shoulders, others in different parts of their body. When you have headaches or migraines, it's pretty common to realize some sort of tension through your neck and shoulders. So going to see a massage therapist is not uncommon. If the massage therapist has helped, that's because they're addressing and able to reduce the level of tension you're carrying through your neck, through your suboccipitals, those little tiny muscles in the base of the skull, backside of the head. And that can be of great benefit. Okay, so we're going to talk about why that's helpful, but also what layers need to be addressed that are deeper than maybe the layer of muscle tissue itself. So at a high level, if you were to take a snapshot of what we do here at Novera, like other than me wearing a bow tie and the patient being fully clothed, it would look like we're just putting pressure through the neck. We're putting pressure through the shoulders. And so the techniques are easily put into a camp of massage by people that don't understand what is happening. So let's talk about the problem in the first place and the origin of these headaches and migraines, and then we'll apply the treatment approach and why we have stepped into this and have what I would say the extent of our success in treating even the most challenging headaches and migraines. We're going to talk about why we've been able to take it further than most have experienced. Okay, so the problem itself. The problem is really a lack of mobility, all right? So we talk about a lot of things that can impact your life on this podcast, but the one thing that's at the center or the epicenter of your symptoms and actually is like generating and driving that pain signal is a lack of mobility. And more specifically, it's in the upper part of the neck. You see, when we turn our head or look up and down and even side bend, the upper portion of our neck is responsible for a lot of that movement. So let's take rotation, for example. When you turn your head left or right, the first bone is shaped kind of like a donut. It sits on a thumb-like structure of the second bone. So those two bones interacting allow us to rotate. About half of our rotation, or 45 degrees or so, should come from C1 and C2, so the first bone and the second bone, okay? Now that's hugely important because if we don't evaluate that and understand how much movement you have through C1 and C2, we can't properly assess your neck, if your neck is healthy or not. All right. The other components of the upper part of the neck are nodding. So the head sitting on the first bone should nod. There should be about 10 degrees of forward nodding that we see. Now, oftentimes the head is resting on that first bone. It's not in a neutral position. So it's extended in an extended position. If you think of sitting at a computer and your shoulders are forward and your head's forward, but the screen is still up at about eye level, your head has to extend a little bit in order to accommodate to what you're looking at and the resting position of your neck in relationship to the rest of the spine. And so it's natural to have a little bit of extended head position with the sitting posture that we find ourselves in throughout the day. There's different reasons for the head to sustain this sort of extended position, but that's a common one. So that's an example. So we find a scenario where C1 and C2 aren't rotating like they should, and the head sitting on the first bone, we call that the OA joint, that's not nodding like it should. And so there's one other element to this, and that's side bending. So the head should side bend, and the first bone, the atlas is what it's called, should shift. If it's side bending to the right, it should shift to the right. Side bending to the left, it should shift to the left. Now, oftentimes people will have a prolonged, sustained side bend or slight side tilt to their head. And so they find that the atlas has adaptively sort of just found its home, setting a little bit off to the right of midline or to the left of midline, depending on the side that you bias for the head tilt. Next time you look in a mirror, you'll notice you have a little bit of a side bend. Okay, so there's the problem that we find. We find that C1 and C2 are not rotating. We found the head sitting on the first bone is not nodding. And we find that the head sitting on the first bone is also kind of shifted to one direction or the other. Now, there's a few scenarios that would lead to there's actually a lot of scenarios, and I'm not going to go through them extensively, but there's physical stress that our body carries every day and is responding to. So gravity weighs down on us, and our muscles and our joints are designed so that we can act against those muscles and then function. We can reach up overhead, we can turn our head, we can pull our shoulders back, we can run, we can jump, we can sit. So we can do all these different things and respond to the physical stresses that are placed through our body. Now, the dynamics of how we're interacting with the physical stresses throughout the day and what we ask our body to do, it can be done efficiently and there's really no harm done and actually can be therapeutic, or they can be done in a way that they do add stress to the body over time. And so I use the dental world as an analogy, and I'll say, all right, you would never go to a dentist after your teeth hurting and say, well, I haven't brushed and I haven't flossed and I've eaten whatever I wanted, but I never had any sort of like trauma to my mouth. I never got punched in the mouth, so there's no real reason for my teeth to hurt. Well, the dentist would probably look at you kind of funny and say, well, if you've never done anything to prevent this problem from happening in the first place, if you've never brushed, if you've never flossed, if you've never paid attention to the to your diet and how that's impacting your dental health, then of course your mouth is going to hurt. And so the example here is such where we go through life, and life is not neutral. Most of our lives are pulling us downward, okay? So, I mean, life in general, as we age, things deteriorate. Our bodies are less capable. And so we see in general, though, that the physical stresses that everyone puts through their bodies, is pulling us into a state of dysfunction, of increased tension, and the potential for irritation and pain. Now, the neck is tasked with a specific job. It is tasked with holding up a 10 to 12 pound head. It's the weight of a bowling ball, okay? It's holding this bowling ball, and not only does it have to be stable, okay, and sustain prolonged like sitting postures throughout the day, but it also has to be able to turn about 80 to 90 degrees one way, 80 to 90 degrees the other. It needs to be able to tip the head back and then look down. So extension, flexion, it needs to be able to side bend, okay? So it needs to be able to do all these movements, have a lot of mobility, but also then have the stability to sustain the 10 to 12 pounds throughout the day, all right? So if we start to understand the dynamics of the neck and the physical stressors that we place on our body, time is not neutral. Time is actually working against us. And so we need to do things that are proactive and are going to help prevent time being a negative to the extent where we have issues in the neck and then it's causing headaches and migraines. And so you do not need to have any sort of trauma. You do not need to have a whiplash injury or a car accident or some major incident that you remember that caused trauma to your neck. You definitely don't need that in your backstory. Anyone that has not and even if you're relatively fit and you're active and you are attempting to be healthy in your life, it's still something that can occur. And it's almost because there's a scenario where people are more vulnerable, okay? Just like in the dental world, maybe you're more prone to cavities, okay? So you have to be more cautious. But doing all the right things can still basically land you in the dental chair with a cavity. And same here. Like, you could be very mindful and aware of your body, physically fit and healthy, but still end up with headaches and migraines. And there's different dynamics there. There's the other scenario where you actually do have trauma. You have some sort of head or neck injury, motor vehicle accident, whiplash injury, you fell off a horse, whatever it may be. And that physical trauma does, in the short term, it heals. There's a response to whatever trauma. The tissue's angry. There's inflammation. But then as the acute injury heals, there's a prolonged sense of it changes the way you move. It changes the mechanics of the neck and the shoulder. And now they're still happening. You're still functioning, but it's not necessarily as efficient or as easy as it once was. And so you have sort of a general, it leads to, over time, a buildup of tension, okay? So there's always a lead up period of neck tension. So the neck tension there's a gradual building up of the neck tension as well. But there's a period of time that you are able to function with these restrictions through the neck, and you're fine, meaning you have no symptoms. You may not even feel like your neck is tight. You don't really have headaches or migraines. And then all of a sudden they just hit. And for some people, it feels very random. Other people would say maybe there was something in their life, whether it's a stressful event or something physical that happened that seemed to trigger it. Either it pushed the tension line up and you started to realize what was happening, or it dropped your threshold down. So that could be anything on the threshold side, from hormones to gut health to on the physical side. I don't know, maybe you had an office desk job, or you were a student studying all night, and that physical stress through your neck was too much. I've also had basketball players who get jostled a little bit in a game, or something happens that doesn't feel significant, but it's just enough to push the tension you're carrying up into the zone of now you have headaches. Okay. And so the impact that the tension on your neck has, meaning you're still able, the people that we see with headaches and migraines that have the tension running through their neck isn't moving like it should. What happens is the muscles now respond to that. And the muscles that are moving your neck and helping to stabilize your neck, they have to work extra hard. All right. So they're trying to turn these joints. They're trying to extend and flex, and they're trying to keep your head in a neutral position. But the joints aren't letting them do their job, at least not well. And so they're having to pull extra hard, and they're having to find other ways to get the job done. The mid portion of your neck probably takes on a higher level of stress. Not probably, it does. And so what happens is the mid portion of the neck oftentimes is where we see the degenerative changes or the wear and tear. If you go get an X-ray and MRI, they're like, yeah, C4 or 5 or 5-6 is really worn out. Okay. And they'll say, well, that probably doesn't have anything to do with a headache, but it is something in your neck that might need to be treated. Okay. So that's an indication that the upper part isn't moving. The mid portion of the neck has had to pick up the slack. The other thing that you'll experience is likely you'll have shoulder tension. Your neck will feel like it's tired. You're always kind of shifting and trying to find a comfortable position. Maybe prolonged sitting is just challenging. The body just maybe naturally, you just want to move more. You feel like you can't sit still. We also, on the other end of things, maybe it's challenging to exercise or to work out or to put any extra load through your shoulders or through your neck. Maybe you do sit-ups and like your neck feels really tired or fatigued and you get a headache, or you do shoulder presses, or you shrug the shoulders, or you do any sort of weightlifting and it feels like that's a trigger. That's because how you function has been, it's basically not as efficient as it should be. And so your muscles are trying really hard just to do the basic stuff. And then when you ask them to do more, like you go to the gym and you work out, or you lift heavy dumbbells, or you do bench press, or you do sit-ups and your head's just hanging out and your neck has to like hold your head up. Those things are in addition to just the daily stuff that your neck was already having a hard time with, that increases the amount of tension and then throws you into a headache or a migraine. So the exercise is good. We want people to work out. We want people to be healthy, but it may just be too much for your body. Okay, so we've got all these dynamics. So hopefully I captured a lot of people in what I just described, but that is the problem. Okay, so with that being the problem, we step into the treatment side and we ask the question, okay, now this is a physical problem. This is something the musculoskeletal system, muscles, bones, joints, ligaments, like we need to address those. Well, what does the musculoskeletal system allow us to do? It allows us to move. Okay, we're not static creatures. We're not static beings. We don't just stand here. We're not designed to just sit at a computer. We're designed to move. And so our whole structure, our musculoskeletal system, should be moving. And so we need to figure out how to move and how to restore function, how we should be doing it properly, okay? So that's ultimately what a physical therapist is trained to do. Understand movement problems, understand how the body is designed to move, and then restore that mobility, okay? So we could take, if we look at the spectrum of healthcare and the types of providers that are available to help restore the body's physical function, proper function, physical therapist is probably the best trained education. And then as far as like treatment approach, there's a lot of other things that can impact the musculoskeletal system. And so let's take just the Western medicine model. So someone with an MD behind their name, that may be like a physical medicine doctor or a pain management doctor or a neurologist. So let's start with like, for example, like Botox injections. Injected into the muscle's paralyzed, the muscle's not able to function. Well, that muscle was tired and fatigued because it was trying to move the neck and stabilize the neck and responding all those stresses throughout the day. So, okay, the muscle's a problem. Let's paralyze it with Botox, and then you feel better. Okay, did we address the problem? No, we didn't. We just shut off a muscle. And I have a episode on Botox, and I would argue there's long-term negative effects from doing that repeatedly. But we take something like a trigger point injection. Okay, so the muscle's really angry. The muscle's sending a pain signal. It's contributing to the headache. If we inject a steroid or something into the muscle itself, the inflammation calms down. You feel better. Did we solve the problem? No, we just impacted that specific muscle and reduced the level of inflammation. But ultimately, the body doesn't know to move any different, and so that the problem that's there in the first place is just going to pop right back up. And then if we look at things like medication, those are working not necessarily on the physical problem. They're not like interacting with a muscle necessarily, but more how we perceive pain. And maybe serotonin levels are increased, or the receptor to serotonin is, we're mimicking serotonin. And so there's different things that will sort of mask pain or reduce the amount of pain we have, or help our body cope with the pain. And that's sort of in that pain transmission segment of things in how we perceive pain. But again, it's not solving the problem. It's not changing how we move. It's not restoring proper mobility that should be there. Okay, so that's, let's say, the traditional model. And then we have, let's say, chiropractic. So chiropractic is definitely getting us closer because they're going to look at alignment of the spine, potentially. I think I can safely say that generally chiropractors are trained to evaluate and treat based on alignment. And so they're looking at the spine and they're trying to get things to line up correctly, right? So like you're standing still. It's like, okay, your head's tipped and the curvature isn't what it should be. And so they do the treatment or the adjustments and are trying to, line everything back up. And I think that can be really helpful. It's definitely something where if we are physically interacting with the spine itself, and the adjustments are allowing certain segments of the spine to be in a more neutral position, I could see how there's an argument where you can move better and you can function better and you feel like your mobility is improved. So I generally think chiropractic can be helpful, and I do think it's a model that, especially if you've just gone down the medication route, maybe chiropractic is something you give a try. Largely, though, it's different because the focus is on alignment, which is still something. It's a still image, like it's an X-ray. They're looking at a still image, and so we're missing movement. We need to evaluate movement and restore movement and understand how muscles coordinate and how the shoulder functions and how C1 and C2 rotate, like how much rotation we're getting, what the dynamics of the neck are when you side bend, and we miss all that when we're looking at a still image and focusing on the still image. Okay, and then if we look at massage, like I talked about in the first part. And again, I'm not the intent of this is not to like hate on other professions. That's definitely not the goal of this. And I don't think that massage therapists, and maybe I'm wrong on this because I've talked to massage therapists that feel like they're trying to get more medical. I'm fairly confident that massage therapists are not allowed to make any sort of diagnosis. And so, but if you come to them with aches and pains, they'll try to, treat those in a sense. I'm not sure if that's verbiage that would be used or language that would be used. Someone can email me and let me know if you're a massage therapist out there listening to this. But anyways, the idea is that the muscle tension that's sort of downstream of this dysfunction, it's part of the dysfunction. A massage therapist intervening and applying hands-on techniques to help reduce the amount of tension can also be a really good thing. It can be helpful for a lot of people. It is part of the problem, meaning the muscle tension you carry is either contributing to, it could be the primary source of a lot of the pain that you're experiencing. And so having a massage therapist work through tissue tension and help the muscle to function better is definitely a positive. The thing that we need in order to unlock these problems that you've been experiencing with headaches and migraines and truly solve the problem of getting you functioning better, there's a few things. Okay, so the main thing is to look at joint mechanics and how the joints are functioning. So we talked about the upper part of the neck and the stiffness that we find through C1 and C2, the head sitting on the first bone. So that lack of movement over time, the body adaptively changes to that. So if we don't use mobility in a certain joint, the saying is if you don't use it, you lose it. And so the ligaments that surround the joint have likely adaptively shortened. And so the process that we need to take someone on is teach that joint how to move again, okay? Because it's a little bit more complex than saying like, oh, just do these simple neck stretches. And then like you can't just like pull on your head one direction and then that isolates the upper part of the neck. So we need to apply specific pressure to the upper part of the neck in order to start seeing C1 and C2 start moving again, or the head sitting on the first bone start nodding again, or to see the atlas start shifting again. And once we see the upper part of the neck start to move and it's freed up, the muscle tension that you carry through your neck, through your shoulders, the mid portion of the neck, like all these other all these other types of tissues, the muscles that are trying to get this movement to happen are now able to do that. They're able to rotate your head and hold your head in a certain like neutral position with less effort. And so they start to calm down. And your body starts to realize like, oh, we can function, we can do this stuff, the normal daily tasks, and we don't have to be angry, okay? And so getting to the joint level with the hands-on techniques, and specifically in the upper part of the neck, is the key for a lot of people getting them out of this of this headache and migraine cycle. And so that's a lot of our focus. Now, if you're thinking, this is great, I live out of state, I can't necessarily come in person to see you, that's okay. So the SAM device is definitely something I would encourage you to look into. We now sell the SAM device on Amazon, so you can just go to Amazon, search medical device. You might have to scroll through a couple pages. It just got on there, so it's not like it's the first one. Or you can go to the show notes, and we'll put the link there. But you can purchase the SAM device. The SAM device is designed in order to help improve the mobility, so focusing on the joint level of the upper part of the neck. And it's very safe. You just apply pressure, your own pressure, so you're using the pulley system, which pulls a little bit on your head, and it blocks the upper part of the neck from rotating. So it blocks that C2 from rotating, and then you're turning as you apply pressure through the rope, and then you're feeling a stretch through the upper part of the neck, and it may be this sort of wrapping up and around, like reproduction of a headache type pain. It's probably going to be relatively sore. This is our sort of way of providing people that can't come to see us with a solution to help target the upper part of their neck. Now, in addition to that, there's a lot of things that can be done through our coaching program to just help the impact of your day be less, and then to add in therapeutic things so that you are actually giving your body the movement that it needs. And there's nuances to what that looks like. So that equation for someone that can't come out in person has worked really well. And so don't feel like deflated if it sounds like I'm saying you have to come see us here in Colorado Springs, because that's not true. We help people all the time that can't physically come here to our location. And that's how we do it. So look up the SAM device, purchase it, let us know what you think, and reach out to us for coaching. Of course, if you're here local, come see us because we want to help you. We want to be that missing piece in your journey so that you can get off of meds and stop worrying about when your migraine's going to hit again. So just to recap, the underlying problem with most people that have headaches and migraines that's driving this pain signal is the upper part of the neck referring pain into the head. The upper part of the neck would have pain in the first place because it's not moving like it should. And it's not moving like it should either because, stress, physical stress through the body over long periods of time that build up, or the trauma, some sort of whiplash injury, something like that in the past. Okay, so there's a dysfunctional movement, and as you're moving and going about life, there's just tension that builds. It kind of accumulates in the upper part of the neck, referring pain into the head, leading to what you know of as a headache or a migraine. The treatment approach, there's the medication route, which has obviously its side effects. There's the chiropractic route, which I would say is in the good, probably worth trying category, and then the massage therapy, which is also in the good, probably worth trying category, because they're physically impacting the musculoskeletal system, but without the side effects and the potential for I guess what I could call harm from drugs down the road or immediate. And so, but ultimately we need to get at the joint level and restoring movement, looking at this problem through a movement lens, so that we can start restoring function, proper function, and then reduce the level of tension through the neck so that you don't have headaches or migraines anymore. So that's our process with my shameless plug for the SAM device, because it's awesome. And we have lots of people. We have hundreds of people that are using them currently, and a lot of great feedback, people that say it's life-changing. And so I want to get it into your hands. Go on Amazon, search migraine device. That does help our algorithm if you're able to search migraine device, scroll down until you find it, and then purchase that way. But you can just click the link in the show notes and get it that way. I probably had an ad that jumped into the middle of this, so sorry if sounds like it's all about the SAM device. But yeah, it's unashamedly because I want you to feel relief. Thank you all so much for listening to the Headache Doctor podcast, as it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. We'll see you next week.